Hello, my name is Lisa Hayward and I work at the Bureau of Student Wellness at the NHDOE. My session today is for parents and educators who are worried about their children's internet use during social isolation and COVID-19, specifically social isolation. So I've prepared a PowerPoint and I want to go through some slides with you. And if you have any questions, you can't ask them now because this is a recorded session, but you can email me at lisa.hayward@doe.nh.gov. So let me start by sharing my screen with you. And we can go through this PowerPoint slide together. So this is internet addiction during COVID-19. What is it and when to worry? So the session overview has got really three parts to my session. The first part is backdrop and data. Part two is internet addiction real? What are the definitions and symptoms? And part three is perspective and keeping a level head. The effects of too much internet and some strategies you can adopt in your homes to regulate internet use. So starting with backdrop and data, I want to acknowledge that most of the internet addiction studies have largely been conducted in South Korea and China. So it's still a relatively young research field in the United States. However, there was a 2019 Pew Research study about US adults and the internet. And the findings were that 77% of Americans go online every day. 43% go online several times a day. 26% are online almost constantly. 8% go online once a day. 11% go online a few times a week. And roughly 11% don't use the internet at all. It's harder to find data about the usage of children, but tweens living in households with an annual income of less than $35,000 spend about 5.8 hours per day on screen media. Tweens in households with annual incomes of above $100,000 spend about 4 hours on the internet every day. Teens living in households with an annual income of less than $35,000 spend 8.5 hours per day on screen time media. And teens in households with an annual income of above $100,000 spend about 6.8 hours a day on the internet. So there seems to be a correlation of some sort between household income and internet. Where do people access the internet? About 52% of people access the internet on their mobile phones, about 43% on their laptops and desktops, 4% on tablets, and other devices like gaming consoles account for about 0.14%. So moving along now that we've kind of got a general feel for what's happening, is internet addiction real? I think to answer that question, I've got to step back and really talk about what makes a real diagnosable mental disorder. And in the United States, there's actually something called the Diagnostic and Statistical Manual of Mental Disorders, which is the DSM. And this text is the authoritative text for mental disorders. Now, every few years there's a new version of the DSM, and the current version, the DSM-5, does not list internet addiction as a mental disorder. The other measure is a more international text used by the World Health Organization, and that's called the International Statistical Classification of Diseases and Health-Related Problems, so the ICD. The ICD, in its most current version, which is 10, also does not list internet addiction as a mental disorder. But I want to point out that both the DSM and the ICD are thinking about including internet addiction in their next version. So in the DSM, that would be DSM-6, and for the ICD, that would be the ICD-11. Why, you might be wondering, is it so difficult to put this into the DSM? Why is it so difficult to have internet addiction classified as a real bona fide mental disorder? And part of the conversation about this, or part of the difficulty, is that there's a fundamental difference between addictions on the internet and addictions to the internet. So in other words, an overwhelmingly majority of individuals who are allegedly addicted to the internet are not really internet addicts, but these are people and individuals who use the medium of the internet as a vehicle for other addictions. So in other words, if the internet didn't exist, they would still be manifesting their addictions in live face-to-face formats. So there's lots of conversation about what is internet addiction. In the United States, the American Psychiatric Association says very firmly that internet addiction is a common disorder and it should be included in the DSM. In other words, internet addiction is real and it should be treated as a real mental disorder. So if there's such confusion about it, what is internet addiction? How do we recognize it? And are students and our children at risk during COVID-19 social distancing for becoming more prone to accessing the internet and becoming addicted to it? There are really 5 types of recognized internet addiction. And I'm going to use the word internet addiction in this presentation, even though it's not included in the DSM. As we go through the 5 types of recognized internet addiction, I think you're going to find it's highly unlikely that your children or your students engage in these types of behaviors. That being said, the first type is called a net compulsion.